Dr. Joe Congini with us in studio, Akron Children's Hospital. Joe, I always scratch my head this time of year before we get into your subjects. I was out in Goodyear last week, as you know. It's amazing to me how good a shape all these Major League Baseball players are now compared to 20, 30, 40 years ago. But yet the first couple of weeks of camp, we see guys out for the year. This guy's out 4 to 6 weeks, 6 to 8 weeks, where before in the 60s and 70s and even into the 80s, these guys nearly didn't work out as much, and they never got injured. And now we work out, and they're all getting injured. Are we overworking the muscles?
I think we might be, but, I think we ought to just put up poster children of guys like Mickey Lolich and David Wells. Let's get those kinds of guys.
And let them go.
Come on, let these guys be the role models of the future.
I'm here for John Kruk, by the way.
But from a medical standpoint, isn't that a head scratcher?
I think that is the part of it, though, is definitely, overtraining and the same sort of things over and over again certainly is a part of it. And like everything's there's only so far you can push it. We talk about it all the time. Bigger, stronger, faster. To what point? How far can we go with this thing? And these people are all pushing to be the very best they can be, and sometimes they just go over the top of too far and they break down.
And when we see some of the breakdowns, it seems to me, I'm no doctor, but pecs, lat strains, calf strains, that seems to me overworking the muscles.
Yeah, a lot of abs. Yeah, no doubt about it.
All right.
And so we have some of the best this weekend. This is a really big thing for us, and it's so good. We, every year, this is our, what is it on the brochure here, 15th year of sports medicine update we do. It's called Building Young Athletes Safe and Healthy, and we have all professionals that deal with athletes come into town. We routinely now are getting 220, 250 people. We had to move it out of Children's, and the last couple of years we've been at Firestone Country Club. They've been great hosts, and we have it there. And we have 220 signed up already this week. So Friday. And we try to raise the consciousness in our community of some of the national and international experts. We have the international expert, a guy by the name of Doug Casa, is one of several of our international national experts from the University of Connecticut, Corey Stringer Institute. He studies every case of sudden death, catastrophic things that go on the field. I've talked to you about heat, head, heart, and he figures out what should and could be done in every case, and then he comes up every year with guidelines about what's the best way to treat these emergencies. And I want to tell you that in our community in the last 2 years, there's been 3 cases that could have been catastrophic, possibly even deaths. A lot was written about the kid from Revere out on the track where the AED saved his life.
Yes.
One not written as much on our team. We take care of Warren Harding, and last fall there was a freshman football player that went down. The coach freaked out, called our trainer, Alex McCaskey is the kid's name. He got there, knew exactly what to do, got the AED, got the kid saved. We had an episode at Hoban, I witnessed it, with a great big kid on that Canadian all-star travel team, 320 pounds, significant heat cramps and moving into heat illness, maybe heat stroke. We threw him in a large pool with all of his equipment on, and immediately, and that's part of because of the what Doug Casa's telling us. So Doug is in town Friday morning, and he will tell us everything there is to know for all the professionals. We want to heighten the awareness of everybody in the community about what to do in those emergent catastrophic situations. So he's awesome. There's a PT from University of Wisconsin who's absolutely spectacular speaker by the name of Brian Heiderscheit. He's going to be there. And we have also somebody who does really new ultrasound work at the Cleveland Clinic. Now she's got her own practice in Cleveland. She's one of the nation's experts, and she's going to talk about how we're diagnosing a lot of these things now without having to use MRI, CAT scan, and other things, some of these nerve problems that are so difficult for us. And Dr. Delzell will be with us as well, so Patricia Delzell. So anybody still that would have an interest in coming to this.
So I was going to say, is this open or is this an invite?
Cutting edge. No, it's an open thing, but we have to cut it at something. I think they told us 260, but we'll be sardined in there. We've got 220 already now, but Amy runs this like a top. It runs really well. It's all day. Anybody that has interest, there's a lot of other things too. Of course, we have some orthopedists talking about knee injuries, and we're talking about a couple specific things in sports medicine also. Concussion gets a little bit of a discussion there too. Amy Chand heads it up for us. Her number's 330 330-543-2126. 330-543-2126 if people want to see if we still have some seats open. But we decided to make this not a 101 course. This is cutting edge. What's right now state of the art. One of the great talks going to be on BFR is this blood flow restriction. Have you seen that, where athletes wear these strong bands that restrict blood flow, and there's some evidence that it helps them get stronger with BFR.
Wow.
There's going to be a lot on needling and cupping and all those things.
That I see when I go to Goodyear. I see a lot of the cupping now.
Yeah, so this is cutting edge stuff. This is last 5 year stuff. This is some 101 course like, oh my gosh, 1995 sports medicine. No, this is really cutting edge, and people that want to be on the cutting edge, lots of the trainers from the area, PTs, lots of nurse practitioners now, and docs too. So anybody who'd like to come to this, we have a great speaking group this year.
Joe, isn't it amazing? You go back to when you and I played football way back when. Remember, we did everything in the heat of the day. We kind of thought, coaches and players and parents, we all thought we were all invincible, but really not. And here we are now in 2020. How different. I think you in the medical profession, I think people in the education systems, parents and kids have done a much better job of really centering in and seeing what is healthy and what is not as far as the heat I'm talking
We
about.
have no doubt we're doing better. The word is getting through. In the state of Ohio, they give credit to a guy at Ohio State by the name of Robert Murphy. He was really the guru of heat in Ohio and did a good job. But part of it, Ray, was we did not have all the social media and the internet and things like that. There were a lot more cases of kids dying in those days. We just go back and look at the numbers. So with, for instance, neck injuries and paralysis, we were up in the teens, 20s, 30s a year in this country. We've had several years in a row of 5 or less and 1 or 2 years of 0 kids getting paralyzed in football. We used to have, in states like Ohio, 10, 12, 15 people with sudden death from heat illness. Nowadays, it's really a big story if it's 1 or 2, but there's still too many. There's still in this country is 15 or 20, and 15 or 20 is too much for a preventable problem like heat illness. So let's do everything we can to try to prevent these from occurring and taking away from the great lessons that sports can teach.
And, of course, having the machines at all the football stadiums have really worked, too. And so many people led the charge in Ohio and across the country.
The machines.
And again, 20 to 30 years ago, we didn't have that.
You mean AEDs?
Yeah.
The AEDs, fantastic. And again, I'm going to give shout-outs to people who came before me. Terry Gordon. Remember when Terry pushed hard? And people were wondering, are we really going to have things?
He had to educate us on that, remember?
Yeah, we did. And so there were a couple other cardiologists with Terry statewide. So I've been on these for a long time, too. And there's a lot of great people that went before us on the shoulders. But now we want to disseminate that information. So we have a great group Friday that we're going to get that information
Sounds
to.
Terrific.
Looking forward to it.
And hats off to you, too. You've really been really tall in fighting this concussion thing. And you and I have talked about a lot here on this show, and you've traveled the country doing the education with that. So sometimes we don't. If no one's going to pat you on the back, Joe, I will. You've done a great job.
Yeah, I don't need pats on the back, but but thank you very much,
Ray, because
I love it. I love working with kids. It's my passion and love in life.
I know you do. Thanks for coming in, Joe.
Thanks.
Dr. Joe Congini, Akron Children's Hospital with us.